लेडीज़ एंड जेंटलमैन, हम मेंटल हेल्थ की जब बात करते हैं, मानसिक स्वास्थ्य की बात करते हैं, तो आजकल एक और शब्द साथ में जुड़ गया है, डिजिटल मेंटल हेल्थ, जो बहुत ही ज़रूरी विषय है। और इस बहुत ही ज़रूरी विषय पर बातचीत करने के लिए हमें उससे और ज़्यादा अवगत कराने के लिए मैं मंच पर आमंत्रित करती हूँ डॉक्टर यतन पाल सिंह बलहारा, प्रोफेसर साइकियाट्री, नेशनल ड्रग डिपेंडेंस ट्रीटमेंट सेंटर, एम्स। सर, वी वेलकम you. Ladies and gentlemen, at AIIMS, Sir runs the Dual Diagnostic Clinic and Behavioral Addictions Clinic. He is also Secretary of World Association on Dual Disorders. He is a Global Master Trainer on Drug Demand Reduction for the Colombo Plan and UNODC. He is a member of various national and international committees, including the WHO Expert Group on Addictive Behaviors, and Sir has published more than 300 research papers. Sir, we welcome you.
Thank you so much. Good afternoon. I begin by thanking the organizers for this opportunity to be here as part of this. Yeah, it's working now. Yeah, thank you. To be here to share my thoughts on this theme with you. And I've been asked to talk about digital mental health. So primarily what I'm going to do in the next couple of minutes is talk about context of digital space and how mental well-being and digital wellness is connected, and why is it important to talk about it. I'll talk briefly about some of the work that we do at AIIMS, AIIMS New Delhi. And at the end of it, I'll present the work that has been done by the expert group in terms of the newer indicators or indices that have been developed in this context. When it comes to digital well-being or mental well-being in digital spaces, we must remember that when anybody, including any one of us, we venture into digital space, there are multiple factors that are at play. And these factors, they actually determine how our psyche or our psychology reacts or responds to our presence in that digital space. There are multiple such factors or mediators. I have listed a couple of them there which are relevant in the context. Things such as expectancy, which means that when you venture into digital space, what is it that you expect from it? It impacts your psychological well-being. And just to give you an example, think of you using a social media platform and posting a message there. Your expectancy could be that you wanted to convey your thoughts or even feelings at times to others, and it ends there. Your expectancy can be more than this. Yes, you wanted to post it, but you are also interested in knowing how others respond to it. And it can go even a step beyond that, that you want to share your ideas, your feelings with others. You wait for how they respond, and you are also very concerned whether the reaction is positive or not, whether they like it, whether they forward it. And depending on what is the expectancy with which you venture into the digital space, whether you feel good about it or whether you are troubled when somebody reacts to it in a negative way, it changes the outcome significantly. The experience that we have in digital space, that shapes our mental well-being. If we like our experience, it makes us feel good about ourselves. But if somebody reacts negatively to what we do there, to our presence there, it affects us in negative ways. So there are multiple ways in which this interaction is mediated. But what we need to remember is that this is not just a passive interaction that happens. It's not that there is a platform and we just interact it and there is an outcome. We need to keep in mind that these platforms are actively managed platforms. So these platforms may have many ingredients or many aspects or components which are designed to make us engage with them in a way that the platform wants. There may be elements which make it more interesting, more interactive, better to look at, better to participate in, because when you engage with these platforms, there is an economics behind it. There is a transaction that happens. So many of these platforms may have elements which make them more engaging and at times even more addictive in nature. And that is what people suffer at times They end up spending too much time doing things which they may not be doing, at least to that extent or for that duration of time, and that affects people in many negative ways. We also need to remember is that this is not just a one-way interaction. It's not just that the digital space impacts our psyche or our psychological well-being. We also interact with it, and we are also helping it learn how we want to engage with it. Again, when you use an app or a game or a social media platform, it's not that you are just using it, you are also offering it lot of information about your behavior. You are telling it that what you like about it, you are telling it what you don't like about it, and this information is being captured by these applications, and they help them make them more engaging, and there is this two-way interaction that we need to keep in mind. Now, when we talk of impact on digital well-being, there are multiple channels that exist. There is one pathway that is a direct pathway. For example, you spend too much time, you can't live without it, you ignore rest of your important activities and interests and pleasures. So there is a direct pathway in which psychological well-being can be impacted. But there are many indirect pathways as well. For example, the initial impact may not be on the psychological well-being, but for example, your health is impacted, and it can get impacted in digital space. People who use mobile phones for a long time to play games, they have pain in their thumbs at times. They can have pain in their neck, their back, they can have eye strain, they have what is called as computer vision syndrome. So the physical problem is the first to set in, and then it eventually leads to psychological issues. We get people in our clinics for which problem started with a financial issue that they faced. They spend a lot of money which they did not want to spend online, either gaming or gambling, or even in some activities which are not even games and gambling. And it starts as a financial crisis and eventually ends up being a psychological issue for them. So the psychological well-being can be impacted through direct pathways and multiple indirect pathways, which can be a physical consequence, a financial implication. For students, it can be educational issues that they face when they are in digital space. And there are multiple channels through which the end, that is psychological well-being, is impacted. As part of our work, we work with people who come to our clinic. We run a clinic at AIIMS, it's called Behavioral Addictions Clinic, but we also go out in the community to schools and colleges. And in addition, we do some research as well, and we have focused on this theme in different populations, different kind of target populations, including students, medical students, engineering students, even school students, and we have tried to document that how mental health is impacted. And I'll briefly comment on that in a later part. We have talked about, we have worked with school students as well. We have tried to explore what is the implications for them when they engage with digital spaces and digital technology. We have also focused on specific themes. There are broader domains like internet use, and then there are specific activities that we can talk of, for example, gaming addiction. We have researched on that. We have also researched on other themes like social media, OTT platforms. And we have tried to see how engagement of people, especially youth, with these platforms impacts their well-being. Now, in terms of this impact, there can be multiple implications. I won't give you the statistics because numbers can be boring, but just to give you an idea how people reach us and for what reasons they come to us. There are three broad set of problems with which they come to us in our clinic. One is what we call as negative emotional states, which means that people have been using technology in a manner which is impacting their psychological well-being in a negative way. They may experience anxiety, stress, distress, and some depressive symptoms at times. Then there is the second set where people come to us, they are facing challenges, but those challenges have escalated to a level that we have to now diagnose them with diagnosable mental disorders. So these are people who have developed depressive disorder, anxiety disorder, and at times even stress-related disorders. And these are the people who have a mental illness and they need to be treated for that. And finally, there is a third set of issues which is related to addiction. Traditionally, we talked about addiction to substances and drugs only, but these days people end up with us who have addiction to social media, addiction to gaming, addiction to internet related behaviors. And in fact, these addictions are now listed as any other addiction in our textbooks and diagnostic systems. So this is one way we see these issues when people come to us. But when we reach out to students and youth in community, in schools and colleges, the problems are much wider than that. Now, these are not necessarily disorders or diseases, so people don't come to a doctor or a psychiatrist, but these are important concerns for them. Concerns that how people react to my presence in digital space, concerns such as cyberbullying, cyber stalking, concerns such as I will miss out on something important if I'm not part of that activity that whole of my peer group is engaged in. So there are different issues that they are facing. There are academic challenges. There are students who are irregular with their schools, not studying well, grades are going down, and even failing in classes. We have had examples where people have dropped out of their engineering colleges because they are spending too much time doing a particular activity in the digital space. In terms of what we need to do, there is a lot that can be done. But before we start talking about how to mitigate these challenges or these negative consequences, it's very important that we must acknowledge that the picture is broader than this. And what that means is that we need to look at the both sides of this. For example, when we talk of people engaging with digital space, it's not always problematic. It may be beneficial in many ways, and we must acknowledge that. And that is what actually makes it much more tricky or challenging. Typically, when we talk of, say, drug addiction, our messages are very simple: say no to drugs. But when you think of internet addiction, the message cannot be say no to internet, because we know internet does so much good for us. So that's what makes it even more challenging, that how to strike that balance, that yes, we are in this space, we use it for the good of it, and at the same time we are able to ensure that we don't suffer the consequences which are negative in nature. Now at our institute we do some initiatives, like we work with different partners. This is one work that we did with Delhi Police in schools in Southeast Delhi East District. We went to different schools and we carried out this awareness program some time back. We work with different international organizations like WHO. We prepare these guidelines on how to safely navigate and prevent behavioral addictions. We engage in different teaching and training activities, online mode. We develop some resources where people can assess themselves. For example, this is a scale using which somebody can identify whether they have an addiction to games or not. We also create online resources in terms of online courses which people can take to kind of know more about these conditions and how they can help themselves and people around them. These courses have been evaluated for their effectiveness as well. We run an online portal, it's called Behavior, which stands for Behavioral Addiction. So it's a regional resource for the Southeast Asian countries. And here we put a lot of information, a lot of content regarding creating awareness and knowing more about how to be safe and healthy in digital spaces. Now I'll briefly give you a glimpse of the framework for digital mental health, and I must acknowledge the expert group which has contributed to the development of this. And again, the framework is very similar in terms of the layout that we have seen so far for the other sections. So there are different domains that have been subdomains that have been identified. For example, one is digital well-being and potential for addiction when people are in digital space. And as you can see, there are different sub-themes that have been identified, and an attempt has been made to see where different developed countries and India stand on these. There are other subdomains, for example, content-based mental health issues, and following the same general format, it has been divided into sub-themes, and again the performance of different countries has been assessed on that. Another theme that is relevant in digital space is of child protection. I talked about cyber stalking and cyber bullying. It can be even more severe than that. Childhood abuse, children abuse can happen, sexual abuse can start from online spaces, and that is another parameter that we need to evaluate in this context. And of course, as has been the format, ethical considerations are of equal importance, and the same is true for digital spaces as well in context of mental well-being. And there is a whole set of parameters or variables to assess that bit as well. So to conclude, I would mention that it's very important that we talk of mental health and well-being in this context. And the bottom line is that we need to ensure that we are safe when we are in digital spaces. We need to find the ways in which we can navigate these spaces in a healthy and a productive way without experiencing the negative consequences. So I'll stop there. Thank you.